Well, get the paramedic stat. This health care law is flatlining fast. To the doctor who told the president to his face that this was an economic emergency in the making. Well, Dr. Ben is back with this latest prognosis. The emergency is here, and it doesn't look good. Welcome, everybody. I'm Neil Cavuto, and so much for this.
I think it's important for us to recognize and acknowledge this is working the way it's supposed to.
But is it? The president just putting a key part of that law on hold. Penalties for larger companies that do not comply won't kick in now for at least another year. To Dr. Ben Carson on if it's time to put the entire law on hold for good. Doctor, obviously he was acknowledging what you and others have already pointed out, that this just wasn't going to fly. And obviously give more companies wiggle room so that they, if they have to, make it fly. But you argue it won't fly. Why?
Well, you know, it should be pretty obvious to everybody by this time that the thing is way too expensive, way too cumbersome. We've combined all these different programs that don't work into one gigantic program, the largest governmental program in history, and now we expect it to work without testing it out. Is that ridiculous or what? And then, you know, we have Ms. Jarrett coming out and saying that, yeah, we know it's really complex and we want to cut some of the red tape and we want to simplify it. Why not think about that before you thrust this thing up on the people? And then Mark Mazur, the Assistant Secretary of, let's see, what is he? Tax policy.
Yeah, for tax policy.
Tax policy. And he's saying that, you know, we're going to have some real-world experience in 2014 so that we'll know what the effects are by 2015.
Well, so everything's delayed.
Why not find those things out before?
Right, but everything's delayed. And you know what's interesting, Doctor, is then the financial underpinnings of this are falling apart because those companies and providing that coverage was going to be the base by which you could provide all the bennies of that coverage. And it comes at a time when young people are not too keen on signing up for this, and a lot of the uninsured for whom we upended our entire healthcare system are now not so sure they want this. Low-wage workers themselves, who would be big beneficiaries of this, aren't eager to buy this. So what the hell is becoming of this?
Well, you know, this is not going to be the last delay, believe me. There's going to be all kinds of things going on with all kinds of excuses coming out about it. But, you know, the bottom line is, you know, we've allowed the government just to keep expanding and moving into our lives and controlling what we do. We need to go back and look at the Constitution. We need to read it again and understand what's going on. We need to do things that bring medical care into the free market economy, and then it will be reasonable. We need to look at places like Singapore, which gives their care for 1/4 or less than what we do, and much, much more effective because
they're stubbornly sticking by it, Doctor. I mean, they are saying that we're going to make this by hook or crook work here. I had one Democratic representative telling me earlier, look, you know, this is the law of the land, and we will make this law work, almost as if you're saying we're going to shove this peg into the wrong hole, but we're going to make it work. And when I said, well, you don't have much money to make it work, and says, we can get the money, all but saying we can find it through higher taxes, presumably on the rich. I don't know where this is going, but that's where it seems to be going.
Well, that's why I and several other incredibly well-versed individuals are working on an alternative so it can be shovel-ready, as some people say, when this falls apart.
Amazing. Doctor, thank you very much. And I got to give you credit. You did warn us. Not many were listening, but you did warn us. In the meantime, to the great one on this suddenly great big old mess, constitutional scholar Mark Levin on a White House out of control and now out of options. Mark, what now?
Well, you know, here's the problem, Neil. The doctor's right. You have a complete breakdown of our constitutional system. Neither House of Congress even read this bill, not any member in Congress. You had one-party control at the time for a short 2-year period. Winds up in the Supreme Court. It votes 5-4 with Justice Roberts making the most outrageous claims in his decision. So we have what is now an unconstitutional law imposed on the American people, 2,700 pages, 20,000 pages in regulations, affecting every single human being in this country, 1/6 of the economy. None of these people read it. None of them understand it. We don't understand it. The businesses that are supposed to implement it don't understand it. But their accountants tell them you're going to have to lay people off. You're going to have to drop them from full-time to part-time. You're going to have to get rid of your health care plans altogether, perhaps. These people are going to go on state exchanges. Nobody knows what a state exchange is. This country is now in turmoil as a result of this. And so what does Obama do? He says, well, let's put it off a year so we can get more Democrats elected to the House of Representatives.
Well,
this
I'll tell
is
you what,
a
it had a weird effect in the abbreviated trading session we had today, if you don't mind my getting back to my wonky world, but it does illustrate a point, Mark. A lot of healthcare-related stocks were up on the notion, maybe a misplaced one, on the notion that this delay means this thing is falling apart and the onerous cost to them might not appear. What do you make of that argument that this isn't just delayed, this just might be done?
Well, you know, if I follow the stock market, I'd probably wind up climbing to the roof and jumping off because nobody really understands what goes on there. You
careful,
do, I don't.
Careful, Mark. I pretend that I do. But,
it's your career.
Play with me. Exactly. There you go.
But let me tell you this. No, this thing is not going to die by itself. These statists have been pushing this for a century. And they rammed it through when they controlled, had one-party rule in Washington and controlled all the elected branches. They rammed it through the Supreme Court. Even John Roberts bent over for this. And so they're not going to give this up lightly, and they don't really care if it works. They're trying to push it through an election cycle, which is the only reason they pulled back on it. And as soon as this election cycle's over, if the Republicans in the House of Representatives don't use the power of the purse, which is in the House of Representatives, to try and strike a severe blow against this, they're going to be right back the next year pushing this claptrap.
We should explain, and you know this inside and out, Mark, but I'll explain what the cynical benefit would be of delaying this. A lot of companies say in order to be forced to comply and provide health care coverage for their workers, they're going to have to lay off a lot of workers. So right before the midterm, you could conceivably have a lot of layoffs because of the demands required by this health care law. So you could understand, to your point, why you and so many others are saying it is in the administration's interest, certainly ahead of the midterms, not to force that provision so soon because you'd be looking at layoffs right around the midterms. Now, what happens after that?
Well, exactly. Well, here's what was coming. What was coming was suddenly tens of millions of people who don't pay attention to what's going on in politics in Washington. We're going to find their premiums dropped, or the price of their premiums going up, or drop from health care, or dropped from full-time jobs, or fired altogether, thrown into these state exchanges, not knowing where to go. This affects families and people and individuals and so forth. And then they were going to say, okay, who the hell now is my congressman and my senator, and who the hell did this? Finally, they're going to wake up because it affects them directly. It's not theoretical. It's not academic. It's reality. What happens after this? The Democrats are going to try and muscle through this, play rope-a-dope, and then after the midterm election cycle, they're going to continue to implement it because they do not want to turn back. This is what Alexis de Tocqueville called democratic despotism, with a little d, and that's exactly what it is. It's despotism, and it's time for the Republicans in the House to stop these phony repeal votes and go to the power of the purse and do something to try and pull some money out of this system, out of this Obamacare system.
Well, actually, the history suggests in Washington, whether under Democratic or Republican presidents, Mark, that they just pour more money after it. And the President Bush's Medicare drug prescription plan, which went exponentially higher, cost hundreds of billions more than he had originally hoped. Medicare itself, that started as a $65 million program, now a $1 trillion program. So history suggests if at first you don't succeed, throw more money into it to fail at least more appreciably.
Well, you're exactly right, but I would warn both parties. I know the Republicans think they have an advantage here. You don't. The people are disgusted, and this is starting to boil up. And you're affecting their livelihoods, you're affecting their jobs, you're affecting their families, their health, their well-being. This is not a joke. To them, it's not politics. And they're going to hold people accountable for this, I believe it. If not this election cycle or the next one, but at some point, because this cannot continue forever. The healthcare system, the greatest healthcare system on the face of the earth, is now in complete turmoil. It's topsy-turvy. People have no idea if they're going to keep their doctor or their healthcare or their jobs. Small businesses are scared to death. They're going to have to close up and do other things. This is what Congress and the President and the Supreme Court have done to the people.
But, you know, it's interesting. You talk about you're keeping your doctor and all of that, and you're a lawyer and a good one at that, and I'm not, but I watch a lot of law shows.
As long as you're not a defendant, you're fine.
But I will say this, Mark. You know, the president, when he said you can keep your doctor, he astutely pointed out nothing more than that it didn't mean that you were going to pay a hell of a lot more to keep that doctor. And that is looking more and more likely in a best-case scenario here. So the administration pitching as it is, the NFL, the NBA, now librarians were told of the virtues and benefits of health care, to reach young people who aren't signing up, apparently, or jazzed by this. Are they just selling a lemon, and is that what's going to hit people, or are people that hip to this?
I would warn the NBA, the NFL, and all these old lady librarians out there, you put your fingerprints on this, you're going to be burned by it too. This is a complete, utter monstrosity and disaster, and whoever touches it's going to be burned by it eventually, and they should be, because this is not the way the American system is supposed to work. This is utterly unconstitutional and absolutely contemptuous.
Okay, so think about where we stand, Mark, stepping back from this to bring people up to speed. You have a key provision of this that requires our bosses to provide health care coverage for us, delayed a year. You have a majority of young people who are not going to sign up for this. So the underpinnings and the financial support to help geezers like maybe you and me, they're not there. And those, the 10% or so of uninsured for whom we upended this system, for the 90% of us who were happy with our coverage and by and large accepted it, now don't want to sign up for this. Lower wage Americans who are going to be the direct beneficiaries of this say it's still too costly for them. This thing is in a meltdown.
It's in a meltdown, but that won't stop Obama and the Democrat Party, who hope to muscle through this next election. Look, 30 million people, remember they kept saying 50 million people didn't have health care. Well, under this, 30 million won't. Who's going to pay the most? The young people in this country who need it the least. They're pulling money out of Medicare to help fund this thing. They got consultants earning $200,000 a year. They've already blown tens of billions of dollars on this. I'm telling you something, Neil. This is the worst piece of legislation, if not ever, in modern American history. The way this was passed was outrageous. It is utterly unconstitutional. And what I'm trying to tell you is I don't know how this is going to end up. But whatever party stands up and tries to deal with this effectively will be a successful party, and the other party is going to be punished. The American people, this isn't going to be Republican, Democrat. And by the way, all this talk about class warfare and the rich, the people who get hurt the most from this are your employees, your blue-collar employees, your white-collar employees, working stiffs who go into the office or who go out to the oil patch and they're working and they just assume they're going to be having their health care and so forth, and the president will have taken it away from them.
Amazing. Mark Levin, thank you very, very much. Always good hearing you, seeing you.
God bless, brother.
Hearing. All right, again, I just want to remind you that of the significance of what has happened over the last 24 hours and why this is such an important story for you. All the financial underpinnings that would support and essentially pay for this health care law are gone, or at the very least significantly delayed. The young who won't fund it, the low-wage workers who won't become a part of it, the uninsured who are no longer interested in it, and now our bosses who were effectively going to be paying for it. 4 key groups opting out. For the time being, that spells big trouble for a health care law now on life support. We'll keep you posted. Up next.